Suneeta Mittal. I am working as Director and Head of the Department of Obstetrics and Gynaecology at Fortis Memorial Research Institute. Today I am going to talk to all of you, the young boys and young girls, as to what care you should be taking about your own health and how you should go about it. Adolescent is a golden period. You are growing out of your childhood, entering adulthood, but at the same time you don't have any responsibility of an adult. So this is the best time to enjoy your life. And I'm sure at this stage, many of you do have attractions also towards each other. There are boyfriends, girlfriends mixing with each other. So it's very, very important to understand certain things about all these issues. It's very, very natural as you are growing up to have attraction towards each other. And I'm sure most of you watch Bollywood movies, how they glorify teenage sex. I'm sure you must have heard the song also, मैं 16 बरस की, तू 17 बरस का. But let me tell you, this is not the right age. The right age for producing a baby is after the age of 20 years. That means when you have crossed your teens. And all these media, they will glorify sex, but they will never tell you that sex is also associated with some problems. Sometimes sex with a person you don't know, and if that person has got some infection, can give rise to reproductive tract infections. And of course, sex can also give rise to a pregnancy. So these are the two things you really need to be careful about. I'm not giving you a moral preaching. I know it's a natural attraction, but I'm just telling you, be little careful about it, because if you have a pregnancy below 19 years of age, there are many risks associated with that pregnancy. You are already a child, you are growing, and a baby starts growing inside you, so the growth of the baby can be affected. You are also more prone to develop certain pregnancy complications. That is why we even discourage married girls to produce children below the age of 19 years. The same applies to others. So that is what you need to take care of. You are more prone to have an operative delivery if you continue with that. But certainly, if mistakes do happen, we do have preventive measures. So I will tell you about two very important preventive measures. One is protect yourself against infections. Let your partner use a condom, so that girl will not have infection, the boy will also not get any infection. If girl is having some infection, this will protect both of you. And second is, if still something has happened, some exposure has occurred, emergency contraception is a very good method to fall back upon to protect you from a pregnancy. And still, if mistake has occurred, please still don't get disheartened. We do have very, very safe abortion methods. The earlier the abortion is done, the safer it is, and we can also do it with drugs, so you don't even need to undergo a trauma of undergoing a surgical procedure. So protect yourself, protect your health, protect your reproductive health at all costs, so that you don't suffer consequences of an unwanted pregnancy or consequences of a reproductive tract infection. As parent, one has the responsibility to look after their children's welfare. But I'm sure all parents are aware that these days children do indulge in sexual activities at a very young age. You do need to give them a good sex education, warn them about what can be the problems. But at the same time, if somebody has made a mistake, please don't reprimand your child. This is part of our growing up, and there is safe abortion method available by which she can be helped. So if a mistake has occurred, there is a solution to it, and the solution is not to reprimand or beat your daughter or tell her or give her caller names to help her out of that crisis. by having a safe medical abortion.